We're talking with Gwen Olson today, author of Confessions of an RX Drug Pusher. Talk about your background a little bit and how you got to this and how the book got to be.
Well, I spent 15 years in the pharmaceutical industry. I went in 1985 and left in 2000 and worked for a number of the major manufacturers in the industry such as Johnson & Johnson, Bristol Myers Squibb, Abbott Laboratories, and Syntex Laboratories. And during that time, I was a specialty rep for the vast majority of my career. So I had extensive training because I called on specialists and the academians in medicine. And I called primarily on psychiatry, cardiology, endocrinology, and OBGYN throughout my career. So I sold a number of drugs, a number of different categories of drugs. And as I started to get further educated, I realized that the information that I was being given to disseminate to doctors wasn't fair balanced, that it wasn't, inclusive, all-inclusive of the good, the bad, and the ugly that they needed to know in order to make informed decisions about what they prescribed for their patients. So throughout my career, I, of course, changed employers several times because during the 90s there were downsizings and mergers and all that sort of thing. So for various reasons, I changed employers a couple of times and started to see that this was something that was rampant within the industry. It was not just exclusive to one particular manufacturer, that reps were being trained to misinform and disinform providers of health care. So I got very upset about that, and then after I had a couple of very serious adverse drug reactions from testing my own wares and taking the products that doctors prescribed for me, I realized that what I was doing was contributing to harming Americans rather than helping the health of the country. And I quit and got out and had no intention whatsoever of being a whistleblower or writing a book or anything, because basically, when you become a whistleblower, you lose all of your benefits because we sign as reps, pharmaceutical reps, we sign confidentiality agreements. And so we're not allowed to really talk about the inside workings and controversy about the industry, or you forfeit all of your benefits. Well, I had a niece who was 20 years old, and she was attending Indiana University. She got into a car accident, and they prescribed Vicodin for her, hydrocodone, for pain. And she became addicted to the hydrocodone and had difficulty studying because she was a pre-med student at Indiana University, and she was trying to study for her exams. So she went to a local health food store and bought some ephedra, a stimulant to take to try to counteract the sedative effects of her painkillers. And when she took the drugs concomitantly, she became manic psychotic. And she was labeled as having bipolar illness, and they did not identify that she had a drug toxicity reaction. And so she started her journey of being a mental patient and being on psychiatric drugs. And for a period of a couple of years, she was off and on of a number of different drugs. She was on a cocktail of about 13 different drugs at one period in time. And she decided that the drugs were making her more ill and causing her more symptoms. So she quit the drugs cold turkey and started trying to detoxify and taking nutritional supplements and things of that nature. I wasn't aware at that time, because I'd never sold antidepressants, that you couldn't just cold turkey off of antidepressants. And as soon as she went into a psychotic tailspin because she had gone off of the drugs, I started doing my research, and that's what actually then evolved into the book, because eventually my niece was told by her mother, my sister, that she had to go back on the drugs because she was still suffering, from severe depression, and